Hey lovelies, how are you? Yes, it's another episode of Leaving the Four Walls. Hashtag what happened to you growing up. My name is Obapeni Awojimfoa as always, and today we are still continuing on our food disorders. Our food disorders. We are talking about rumination eating disorder. Rumination eating disorder. Well, this particular disorder is a bit different from the other disorders that I've spoken about in our previous episodes. This particular one is a disorder where the person regurgitate or rechew food that has already been taken. So in the Akan language, they will call it upuwisa. You get most often, quote unquote, it is the animal goat who usually does that. But there are actually people out there who has that condition where they eat and after eating, right after eating, they regurgitate the food and then begin to rechew the food. After rechewing the food, they can either spit it out or like re-swallow the food. They are able to regurgitate it and rechew it because the food is partially digested, so it does not taste acidic like a vomit will taste. You get that's why they are able to rechew it without feeling nauseous or anything that will make them uncomfortable. For rumination, it can happen to anybody. It doesn't have an age limit. It starts from infancy to adolescence to teen to adulthood. So it can happen to anybody and any gender. Let's look at some of the causes. The exact cause for this condition is not known. It's not really known. But research has shown that pressure in the abdomen can be a factor. Also, pregnancy, overeating and eating too fast, stress, trauma, and some other disorders such as depression, anxiety, and other psychiatric disorders or conditions are all factors that contribute to rumination eating disorder. The symptoms are regurgitating of food within minutes after eating, nausea, weight loss, feeling of fullness, pains in the belly, or a pressure relieved after regurgitating. For the effect, you can have worn out tooth, bad breath, weight loss, embarrassment, because people will see you as, ew, why do you have to bring everything you've eaten out and reach you with? That kind of thing. So it causes some sort of embarrassment. And as a result of that, they end up isolating themselves. So, social isolation, they will isolate themselves from social gatherings and even eating in groups. You get it can also damage your esophagus, that is the tube between your mouth and your stomach, and it also makes them malnourished. Let's go to the treatment. For treatment, it will depend on the severity of the condition, and there are no medication available for its effective treatment. However, a behavioral treatment is required. So the person goes through a training called diaphragmatic breathing. This will help the person to breathe well at the start of eating, and it will also help prevent the regurgitating of the food that the person is about to consume or eat. The good news is that this condition does not really physically affect the person. It only causes just some small weight loss and the person is fine. So physically, if you don't really see the person regurgitating and rechewing the food that he or she has eaten, you may not really tell or you may not really know that the person is having a condition of this sort unless the person probably tells you that this is the condition he or she is suffering from or is having. Kindly note that rumination eating disorder is a reflex action. It is not a conscious action. So they don't intentionally eat and then go sit somewhere and begin to regurgitate and rechew the food. No, it is not a conscious thing that they do. It's just a reflex. They don't even know before they realize they are doing it. So please be patient with yourself if you have such condition, or if you notice a child or a loved one is having such condition. Please be patient with the person. Thank you so much for sticking with me again. I'll see you some other time. Please do take good care of yourself in this festive season. Have a great day. Bye.